As of today, there are now 82 confirmed positive cases of the novel coronavirus in Belize City, and data is being analyzed to determine whether there is in fact community spread in the old capital. But there is a worrisome situation at the Dorothy Menzies Childcare Center, where one minor has tested positive. 8 others who are symptomatic have also been swabbed, but the results are pending.
Several residents displayed cold-like and cough symptoms, and as part of that, the caregivers took them to the public hospital to do the necessary procedure. During that time, 2 of them were swabbed for COVID-19, and immediately they were placed in the isolation and quarantine section. A few days later, we got information that the test came back positive, and because of that, even further and stricter measures were put in place. The other ones, again, yesterday, either yesterday, the day before, they were also swabbed, and we now await their results.
They too have been isolated?
From the time last week that they started with the cold-like symptoms, yes, they were all put in the isolation area.
The minor is a teenage girl who shared quarters with at least one other person. Since the lockdown in March, visitations were cancelled and the resident minors were not allowed to leave the compound. But it is possible that the COVID-positive teenager contracted the virus during the month of July, when they were allowed to leave the compound off St. Thomas Street to attend summer classes.
They haven't gone anywhere. The staff that comes in does take their temperature.
At no point was this child out of the facility over, say, the past month.
I cannot say that because what happened is when the state of emergency was lifted, since March to July, they have been confined. So you understand adolescents and them wanting to get out. I know that some of them did partake in some summer class, something at an institution, so we don't know.
And so the Ministry of Health has commenced its contact tracing mapping exercise.
Tracing started on the middle of the week, actually, because once you have a suspect case, you don't necessarily have to wait for the result. And especially because you're speaking about 2 vulnerable situations here. One is the children that are there in the amount, and daycare centers, centers where you care for the elderly, prisons, their populations where you can have a situation that can escalate rather quickly. But I don't have the full report of that contact tracing.
From the onset of the pandemic, caregivers and staff at the childcare center received training, and an isolation area was identified by health officials in the case of a positive patient at the institution. Acting Director of Human Services Department, Elswith Chavez, says that since last week, a number of the resident children began exhibiting flu-like symptoms. They were placed in isolation and quarantined on the ground floor of the building, away from the other resident minors. That protocol will stand going forward.
The entire quarantine and isolation area is completely locked off. So the only ones that have access to that area are the caregivers. Earlier in this year, the ministry staff as well as the institutions were trained on how to work along with the pandemic. They were taught how to use the PPEs because that is something new to us. So they have a lot of knowledge of what they are supposed to do. That isolation area was identified by the Ministry of Health. So like earlier this year, they took us around. We took them around and they designated that area for in the event that this should happen at the institution. If you ever visited the institution, it is the ground floor. That's a wide space. And like I said, the public health officials identified that because of the ventilation. It has proper ventilation. So several residents can do that social distancing while they're there in quarantine and in isolation area. So while that may be of concerns, they are properly in that space that they should be to cause any further contraction of the of the virus.
There are a total of 23 resident minors at the institution. Those who are not suspect cases are on the upper flat of the main building. Their caregivers do not attend to those who are in isolation. Duane, Moody for News 5.